The following PowerPoint is a presentation on the theory of symptom management by Melinda Bender. It's presented to you by Matthew Petrilla and Lauren Plant. The objective of this PowerPoint presentation is to educate the viewer on the theory of symptom management developed by Melinda Bender. By the end of this presentation, the viewer should have more knowledge on the following: biographical information on Melinda Bender, key terms from within the theory of symptom management, a visual description of the theory, how the theory is used in research, and how the theory is used in practice.
Melinda Bender, she was originally from the Philippines. She was the first generation college student in her family. She studied at the University of California, Los Angeles for her BSN, followed by her master's at the University of California, San Francisco, and finally receiving her PhD from University of San Diego, San Diego. Melinda's research focuses mainly on childhood obesity and health disparities in vulnerable populations. Her beliefs are rooted in paying it forward and giving back to those in need. Melinda is very passionate about providing continuing education to the Filipino populations. As she states, "My mission is to empower the Filipino community with the understanding and confidence to combat these preventable diseases and help improve health outcomes in our community."
We'll start with a few definitions from within the model of symptom management. Symptoms are changes in biopsychosocial function, sensation, and cognition. Symptom experience is how a person experiences the symptom through the senses, and symptom management, the process of controlling the symptom.
Definitions inside the model. Symptom outcome, what outcome is experienced by the patient. Person domain, what constitutes the person. For example, age, genetic risk, demographics, and predisposition to illness. Environmental domain, examples are what surrounds the person, culture, job, home life, socioeconomic status, health or illness domain, current state of health, disease or injury, and possible risk factors.
Description of the theory and the theoretical model. Comprehensive approach to symptom management, taking into account the holistic aspect of patient care. The person, environment, and health and illness is considered when applying this theory. And once the symptom experience of the patient is understood, management strategies can be developed, then outcomes can be assessed, and changes made accordingly.
So how is this theory used in research? Systemizing symptom management using this model provides direction for further study, as well as strategies and care, and mitigating the adverse effects of symptoms on people's lives. The Center of Symptom Management uses this model to develop approaches to symptom management in research, education, and clinical practice. It also provides a framework for guiding study of various symptoms in a consistent manner.
So how is this theory used in practice? The theory of symptom management is used to better understand symptoms and how to treat those symptoms with satisfactory outcomes to both the patient and the patient's care team. Now we will provide you an example of how the theory of symptom management can be applied in practice.
Patients diagnosed with cancer often experience a symptom of nausea and vomiting. That symptom can vary from patient to patient. Depending on how that patient experiences the symptom of nausea and vomiting, depends on the intervention used. At times, interventions such as pharmacology with medications can be used. Alternative medicine such as oils can be used. And diet and exercise is also an option, such as the brat diet or a bland diet. It really depends on how the patient wants to go about the intervention. The symptom outcome is that the satisfaction of the patient. Is the symptom of nausea and vomiting better? Is it worse, or is it unchanged? And as you can see the arrows, this is kind of a continuum of care. It doesn't stop at one intervention, goes to symptom outcome, and that's done. It just varies from patient to patient and needs to be interchangeable.
Here is a more complex visual of the model of symptom management. As we see, the symptom experience can be the nausea and vomiting. The symptom management strategies would then be the diet, exercise, medications, or aromatherapy. And then the outcomes would be whether or not they'd be acceptable for the patient based on the level of nausea, vomiting. But then to further the visual, we would add in the person, which would be, an example would be a 75-year-old male. Health and illness would then be his comorbidities, his weight, things of that nature. And then the environment could be where he lives, where he works, what his family life is like, things like that. And then you kind of combine those all into one big picture, interchanging the variables, and it's all about the patient outcome and how they experience the symptoms.
So in summary, the theory of symptom management is used to help better identify symptoms in both children and adults. This theory pays close attention to detail in different aspects of the patient's symptoms and symptom management. In research, this theory is used as a study tool as well as a guiding framework to develop different approaches to symptom management. Lastly, in clinical practice, this theory is used to help manage and better the care and outcome of patients throughout the duration of their care.
Now we will open the floor up to any questions or comments. And here's a slide of the references we used during our presentation and our research. Thank you for your time. I hope you enjoyed this presentation on the theory of symptom management, and I hope the objectives were met.